name is Bradley Chisolm. I'm the principal and founder of the Regulators Practice and champion of CNAR and the amazing organization that it is. I'm here today with two guests to talk about what's happening in BC and all the changes for professional regulation in BC. Sometimes the metaphor I use to speak about what's happening in BC, it's as if the tectonic plates are shifting beneath our feet. And both our guests today are real surfers of those tectonic plates. They've been right in the middle of it, and I'm really interested in hearing their perspective. So I'd like to first introduce Dr. Chris Hacker. Chris Hacker is the CEO and registrar of the new BC Oral Health College. It's the amalgamated college, and that amalgamation happened just a couple years ago. Before becoming the current CEO, Chris was the CEO of one of the legacy colleges, so was able to live and through that amalgamation experience pretty closely. And so really looking forward to getting Chris's perspective on that. We also have Tom Lutes with us today. Tom is the General Counsel for the Architectural Institute of British Columbia. The AIBC has gone through a very interesting process of coming under the Professional Governance Act. So going from single piece of legislation to umbrella legislation. And so he has that experience recently, and he's also been working with us at the Regulators Practice supporting the amalgamation of the 11 colleges into 2 colleges, and so has some interesting perspectives there. So, would love to jump in. We only have 15 minutes, so we're going to get right to it. The first question is to Chris, and looking back on the amalgamation, I'm first curious, how are things now? How would you kind of describe your current reality right now?
Bradley, thanks for that. I think we've actually, it's been a year. It was just September last year that we amalgamated, and I think our framing it at the college is that it's been a year, but it's just been a year. And so it's early days, and you, having been through it, know the mechanics. Normally you focus on the mechanics, the design, the implementation of the amalgamation project and the stabilization. But I think through all of that, it's really been about the people beginning, the people during, and the people after. And when I say people, broadly, we're talking, of course, about the public and our registrant base and the ministry support staff. But I think most importantly, it's been about the people inside. It's the staff teams that are making the changes and excuse me, and feeling the pressure and the uncertainty of what's going on. And so that the change management overall is really important. I think also excuse me, what is a challenge too is just the pace of change as well. And I think we know that during amalgamation, leading up to it, it's helpful if you have a large legacy organization that can be resourced and fund and provide the capacity you need for the change. But it also becomes an impediment afterwards because, of course, you want to make sure it doesn't feel like just a merger into that larger organization. And it's easy to sit back. And so I think the challenge and what we focus on is being intentional about being new. And trying to continue to transform and make that change.
One of the questions that always comes up, and it's either from staff or from partners, registrants, is how is this in the public interest? How is amalgamation actually helping us protect the public more and better? And I'm curious, in the 1 year since you've been amalgamated, is there any examples, is there any things that you can point to say we are able to do that better than we were able to do before?
Really, well, I think it's been well stated in the minister's intent, the proposals and then the recommendations for modernization, that amalgamation was really about broadly increasing efficiency and efficacy of colleges. Again, leveraging resources of a larger organization versus many small ones. But I think what underpins a lot of the modernization change is the fact that healthcare is getting more complex. Gone are the days that our grandparents kind of consumed their health services through the autocratic master, as Harry Caton might call him, or her, who would prescribe care based on what they saw as the needs of the patient. The public and patient have become much more sophisticated, and also as is healthcare as well. And we know technological changes are logarithmic. And so as a result of that, care really needs to be provided by teams of experts. And that's when we can leverage the oversight of an amalgamated college, particularly with oral health, to think that before September 1st of 2022, that if you were to go for a dental checkup and a cleaning and they'd fix your night guard, that 3 colleges would have overseen that visit. When patients engage care, I think they want to know that the expectations, the regulatory expectations for that team are the same. And so the amalgamation has allowed us to start to leverage consistent standards across that team, so patients can be reassured that every member of that team is working in their best interest.
And one of the stories we heard as well in the nursing context was, because of team-based care, I would normally have to go and make a complaint to get with 4 different colleges and learn 4 different types of administrative law processes because I'm making a complaint against a team. And now there's a consistency there, and I'm sure it's the same. I'm going to a dental office. I want to make a complaint against this team of people that all might have certain responsibilities for what happened, and I'm able to do that in one place. And I can imagine that's... Tom, I'm curious, you kind of have an interesting perspective on amalgamation, kind of watching it from afar, and I'm just curious of what some of your observations have been over the last few years, seeing all this happen.
Yeah, I mean, it seems like it's inevitable now, but it didn't seem that way just a few years ago. And now it seems like the tide is coming in and sweeping us all towards amalgamation. One of the things that was brought up this morning at the session is how complex and opaque professional regulation, including discipline, but admissions is for the public. And so to your point and to the point of the speakers this morning, for the public being able to see a single regulatory body that they can approach that has a consistent set of documents, a consistent process, a database when that day comes for amalgamated bodies. It doesn't happen overnight, but these processes and explanations of a process, in addition to what you said, which is not having to go to 4 separate places with 4 different regulatory cultures. So I think if we're talking about the public perspective, from their perspective, knowing how hard it is behind the scenes to make it work and be effective, I think from the public perspective, it only makes sense.
Anything that's been more difficult for you, Chris, than you thought? Like anything, you talked about culture and people, and that, definitely being at the top of your list in terms of, is there anything that has been more complicated than perhaps you were expecting it to be?
Really, I think this will get into the nuts and bolts of it, but I think when we first engaged in the design of our project, we were thinking it would be the regulatory streams that would be the most difficult to manage. Understanding that as the clock ticked on amalgamation and switched over to the new organization, we would still have to be working and protecting the public. That was actually the easiest part of it. And of course, in our interim model, we simply ported those streams over and supported by the bylaws. It was the back office stuff that was really tough. It was the HR, the contracts, the accounting, facilities oversight, all of those things, and then you bring CRA into it, and a changing fiscal year that the administrator insisted on.
And I can imagine a team of regulators will think that that's the most critical piece, but it's actually the people behind the scenes in those corporate service roles that they're the ones that are going to have to do a big piece of that work. So yeah, very interesting. I want to shift gears a little bit to a different process, and that's the process that you've been a part of, Tom. Bringing the architects under the Professional Governance Act. So when the Professional Governance Act was first brought in, I believe there was 5 regulators at the time that were brought in, and the architects are the first regulator since the first 5 that's kind of come under the Act. And I'm just curious of how that experience has been and what you've learned, and what's worked, what hasn't, just any of your kind of top line advice.
I think, like you said before, behind the scenes, the mechanics, the staff who are working it is very, very difficult. The fortunate part for us was there wasn't a lot of change in terms of standards for registrants, so not having that opposition or those concerns was really, really important. And it was well-trod ground. The engineers had been there and the foresters, so we were able to learn from what others had done. the bigger challenge is developing a relationship with government. It's a superintended model, which again is part of the currents that I expect we'll talk about. And so it's a double-edged sword. No longer are you on bended knee to seek a moment with the minister. You can email the superintendent and get a response relatively quickly. You're working with a professional staff in government, and you can move policy and professional standards issues and other factors along quite easily. The other side of it is, of course, a great demand for reporting, meetings, etc. So there's a big time draw. On balance, I think it's a very positive thing, especially if that relationship with the government starts on the right footing and continues on the right footing. Registrants, I would say, for architects, interns, and others, it hasn't made a big difference to them. But certainly in-house, it's been a big change to have government as instead of a silent partner in regulation, which frankly they have been at times, an actual co-managing partner of what we're doing. Yeah.
Okay. And do you think, from a legal perspective, I'm interested, what are you looking forward to most in terms of umbrella legislation versus legislation that's yours and only yours?
Yeah.
Is there anything that you're looking forward to or not looking forward to?
Yeah, I think already we've shown that the umbrella is large enough that the 6 and soon to be 7 and it'll probably be in double digits in a few years, regulators under the PGA have created a community. There's been more of a community in the health professions for a very long time because of that umbrella legislation. But for a lot of other regulators, you are on islands. And I think one of the biggest strengths is the ability to share documents, not reinvent the wheel, to commiserate when commiseration is what's required. But the sharing of a community of regulators is what we expected to look forward to, and it's proven to be exactly what we needed.
You've already sensed that there's more community amongst those PGA
absolutely,
regulators?
Yeah, and very little in the way of there's friction from time to time, overlapping scopes, but it is non-antagonistic. It's a group of regulators with government trying to push forward important public policy matters.
So we have about 5 minutes remaining, and I just wanted to kind of pull back a bit and get your perspectives in terms of just leaders in the regulatory community here in BC. If these are, what is the undercurrents? What are the causes of these tectonic plates that are shifting? There's lots of responses. We have new pieces of legislation like the Professional Governance Act, the new Health Professions Occupations Act, which are dramatically different in terms of governance, in terms of the balance of different entities' roles. We have regulators that have gone into government, like the realtors. We have amalgamations. So there's lots of shifts, and I'm just curious if you were to take a step back, what's happening? What do you think? What is government or what are regulators responding to?
Bradley, I'll go first. Wow, great question. And this is obviously just it's anecdotal, but it's observational. Always, I think, to look forward, we have to look back, and I think we know there's been concerns through government and by their proxy, the public, of a lack of consistency of regulation, too much profession-centric influence in regulation, and that goes back to the 1800s in BC and probably earlier in Canada and other provinces, where some of the first individual health professions acts came in, the Medical Practitioners Act, the Dentist Act in the late 1800s. We fast forward to the end of the 1900s, and the Seton Report and other investigations are laying bare the concerns around a lack of consistency among regulators. And the first umbrella legislation, it's the HBA, comes in 1990s, early 1990s. And through that time, 20 years it takes to get the medical practitioners, the dentists, and others under the Act. And in the meantime, complaints coming into the Ombudsperson's office of lack of consistency and too much profession-centric interest. You fast forward to the Caton Report in 2019, this release.
The same quotes are pretty much in all of those reports.
In the same thing. And so, you're right, I think it's probably a frustration at government's end, and again, a significant public concern that these are still not being addressed by existing legislation. And
what do you think, Tom?
I would agree, and I think probably part of it is that regulators have taken too long to read the tea leaves and make the necessary changes. Change is hard, and a lot of regulators have a culture that can be fairly hidebound. And sometimes what has been needed is legislative change, an audit, an investigation, and a push. The other thing I would say is Quebec has been doing it for decades, and I'm not saying regulation in Quebec is perfect, but there is a model there that I think others have looked at and seen that can actually work. And so umbrella legislation and superintending, it's being rediscovered outside of the province of Quebec, and I think that's something that hasn't been talked about enough as well.
Great. Well, thank you both very much. That's all the time we have. I think there's significant change happening in BC, but I certainly feel more comfortable knowing we have leaders like you at the helm. So thanks very much for what you do and for the service that you provide to our province. And thank you for being with us.
And you too, Bradley. Thank you.
Thanks, Bradley. Thanks, CNAR.